Now there is some problem in sharing. There is some problem in sharing screen. I'm just trying. Hold on. Families of the insured persons who are the employees. So employees plus their families are to be provided with medical care by this particular act of 1948. Now this applies to the factories employing 10 or more workers, uh, and employees of factories and establishment covered under the act should be drawing a minimum salary of uh, you know 18,000 rupees as on today, that is 18,000 per month. And this is extended to provide health care to workers in the unorganized sector like BD workers, cine workers, and non-coal mine workers as well. Now, as on 31st of March 2011, the scheme was applied to uh, 0.44 million workers in India. Now, 0.44 million employers in India, employing 1.55 crore insured persons at 790 centers. I'll repeat this. As on 31st of March 2011, the scheme was applied to 0.44 million employers, employing 1.55 crore insured persons at 790 centers. Now, the contribution that is a qualifying thing here. Now, contribution employer pays 4.75% of the wages of the covered employee. That is, 4.75% of 18,000. And employee's contribution is 1.75% of the wage. So a percent, you can work that out if you want. See, 18,000 rupees that will be around 315 rupees will be paid by the employees, and 4.75% will be paid by the employer towards this fund. Now, agency which runs it is the state government, except for Delhi, Noida, and model hospitals wherein ESIC is directly providing medical services. These ESIC hospitals are spread over India in all districts of India. Now, delivery is medical care. Now, service is through direct system, that is 146 hospitals. And 93 ISM units are there to provide medical care under ESIS scheme. This is direct. Indirect system has got 1,447 panel doctors, and cash benefits are also provided to the employee under this particular scheme. The network of 610 branch offices, 187 pay offices, related sickness, permanent disablement, and death benefits are being provided. Now, employee, this is as far as your, ESIS is concerned. Then another act we talked about is Employee Provident Fund Miscellaneous Provisions Act of 1952, which was passed and became effective from the 14th of March 1952. The aim, just a minute, somebody is poking all the time. Now, the aim was to provide social and economic security to industrial and other workers covered under the Act and their dependents in case of their premature deaths. Now, coverage was to all establishment specified in Schedule 1 of this Act, and to employing 20 or more persons, right? 20 or more persons must be employed by the organization. There are three schemes under this act. One is called Employee Provident Fund Scheme of 1952, Employees Pension Scheme of 1995, and Employees Deposit Linked Insurance Scheme of 1976. Right? We also find that this act provides financial security for the employees in an establishment by providing a system of compulsory savings. Now, benefits are Employees Provident Fund Scheme takes care of the following needs. Upon retirement, the person receives his PF. Medical care, if they require, they can take out money out of it, depending on if the person has got less than 10 years of service, then he has to take loan from the PF. Else, they can withdraw money up to 2/3 amount deposited with the, under PF. We also have got housing for loans can be taken or money can be withdrawn. Family obligation, for example, education of children, you can take out money on loan or withdrawal. Financing of insurance policies can also be done, or marriage of daughters or sons can also enable you to withdraw money from PF. Now, coverage is 182 specified industries, classes of establishments, and this covers 6,15,902 establishment and factories with a membership of 50.8 million as on 31st of March 2010. This net must have increased by now. The contribution as per the amendment dated 22nd September 1997 in the Act, both employers and employee contribute to the fund at the rate of 12% of basic wages, dearness allowances, and retaining allowances, if any, payable to the employee per month. So under this particular scheme, both employer and employee will be contributing, and that is the scheme which it provides. We also find that there is employees pension scheme of 1995. This came into force from the 16th of November 1995. The aim was to the following actuarial principles of ensuring long-term financial sustenance. And this was to cover all new members of the Provident Fund and existing members who were contributing to Employee Family Pension Scheme of 1971, this pension scheme. Member included disablement persons who would get the benefits, widow of will get the pension, children will get the pension, orphan person pension will get the pension, dependent parent will get a pension, and nominee will also get a pension if they qualify for this. There is no separate contribution that has to be made for this particular scheme. It derives its financial resource by partial diversion from the Provident Fund contribution, the rate being 8.33% of the wage of the central government of wages, and the central government contributes at the rate of 1.16% at the end of the year into this particular scheme. But other pensioners will not be eligible under this particular scheme. Now, employee deposit linked insurance scheme is also there. Now, this came into force from the 1st of August 1976. The benefit is given on death while in service, that is, a person dying in harness, the family will get the benefit. Provident Fund accumulations plus an additional amount equal to the coverage balance in the PF fund account of the deceased during the preceding 1 year is paid to the family. Maximum amount of benefit payable is 1,30,000 rupees. The coverage was to employees who are member of Provident Fund in exempted as well as unexempted establishment, and there are 60 million members across the country at the moment. Now, the contribution is to be paid. Employees are not required to pay any contribution. Employers contribute to the insurance fund at the rate of 0.5% of the pay of the employees under this particular scheme. Then we also have got Employees Contribution Act of 1923. This came into force from the 1st of July 1924. The benefit is to be given to persons if they get injured themselves, and this is caused to a workman by accident arising out of and in the course of his or her employment. His employer shall be liable to pay compensation. Now, the compensation is rupees 1,20,000 in case of death and rupees 1,40,000 in case of disablement resulting from the injury. Funeral expenses, if the death is there, of 5,000 is to be paid. Reimbursement of actual medical expenditure is also to be paid to the employee. Then we have got a benefit for the female employees under the Maternity Benefits Act of 1961, which came into force from the 12th of December 1961. This was to regulate the employment of women for children period before and after birth, and provides for maternity and certain other benefits, that is benefits when there is a miscarriage or pregnancy related illnesses. Now, the coverage is to mines, factories, circus industry, plantation, and shops and establishment employing 10 or more persons, including any such establishments belonging to government, except the employees who are covered under Employees State Insurance Act of 1948. Now, this particular act called Maternity Benefits Act, it prescribes that a female employee, once knowing about their pregnancy, must inform to the employer. And the employer is supposed to maintain a register where they will be writing the expected date of delivery as specified a medical practitioner, and the female worker, even if she fails to inform the employer, the maternity benefits cannot be denied to a female employee. Now, this benefit that is prescribed under the Act is 12 weeks of leave with pay, 6 weeks either side, that is 6 weeks before confinement and 6 weeks after confinement. This Act was later on amended, and it was extended to 18 weeks of leave that was to be given in 1998. But that is, it further said that all 18 weeks of leave can be taken on one side, that is after the date of confinement. Later on, this was extended to 26 weeks of leave, and now it stands at 30 weeks of leave. For miscarriage, 6 weeks of leave with pay is to be given from the date of miscarriage, as informed to the employer. It further says that if there is pregnancy-related illness, up to 6 weeks of leave can be given with full pay under pregnancy-related illnesses as well. This payment is for up to first 2 children only. For the later children, if the children are more than 2, then leave will be given, but it will not be a paid leave as such, right? So this is what the Maternity Benefits Act says. It further specifies that if any employer does not employ a female worker just because she is in a family way and will be asking for maternity leave, they are going to be penalized for up to 6 months of imprisonment and up to 5,000 rupees of fine. Or any employer who fails to maintain a register will also be liable for fine and imprisonment of up to 2 months. So this is as far as the Maternity Benefits Act is concerned. Then we have got Payment of Gratuity Act of 1972. The aim was payment of gratuity to employees engaged in the factories and establishment. That is, gratuity is payable at the time of termination of service, either on superannuation or on retirement or resignation or on death or displacement due to accident or disease. Benefits will prescribed in the act was every employees other than apprentice, irrespective of his wage, is entitled to receive gratuity after she has rendered continuous service of a minimum period of 5 years or more. The ceiling on maximum amount of gratuity has been raised from 0.35 million to 1 million with effect from 24th of May 2010. That is the minimum payment is 1 million, that is there 10 lakhs of rupees, and the maximum is also fixed at 20 lakhs depending on to which no benefit a person really is entitled to. Uh, we find that this social security benefit, as we said, basically falls under three kinds of schemes, as we have seen. Number one is the social insurance scheme. Another one is social assistance scheme, and the third one is allied schemes which are there. Under the social insurance scheme, these acts provides for social insurance which is there, and that is provided by the state as per different legislations that has been covered. A social assistance scheme is basically where a person is to be insured and they have got to pay contribution for these insurances which are there. The allied schemes are employee-employer financed scheme, which is not covered in the Act, nor covered by social insurance schemes which are there, or friendly employees scheme, or any other scheme that comes into force that is there. We further find that there are certain contingencies which we have seen in a scattered manner under different acts. I'll just sum them up at one place. We said that there is contingencies in which this benefit is payable. First is sickness is a contingency. Then we have got maternity as a contingency. We have got old age as a contingency. We have got traumatic injuries arising out of employment as a contingency. So under all these contingencies, the amount is payable to the employees. Under sickness scheme, as we all know, that sickness is a contingency under which benefits are to be paid to the employees. Now, if a person falls sick, there is a qualifying period for this particular scheme which is payable to an employee under the social security benefits. Now the qualifying period is that for the first 3 days is called waiting period, for which no amount is payable to the employees. From the 4th day up to 52 days, the payment is to be made to the employee who are there, and these employees will be paid at the rate of 66% of the last pay drawn as a maximum wage. So it is a sustenance allowance. It is not a full amount that is paid to the employee under the Social Security benefits scheme if the person falls ill. Now, in case of maternity, this amount is a full payment as per the Act, and therefore a full payment will be made to the employees under the Social Security benefits scheme. Further, if the person is having traumatic injury arising out of employment, or there is disablement, that is permanent total disablement, because sickness is called temporary total disablement. Here, this benefit is paid for both temporary total disablement as well as for permanent total disablement to an employee under the particular scheme which we have seen in this particular case. Now, the benefits that is paid, the rate remains the same as the sickness benefit scheme of 66% of the wages that is being paid to the employee when they are permanently disabled, as far as this particular scheme is concerned, which is called Social Security Benefits Scheme. Right? Now, there are social security for unorganized sector as well, because 94% of the Indian workforce is in the unorganized sector. The unorganized sector is quite heterogeneous in terms of types of workers who work in the sector, their geographic spread, providing social security benefit in a phased manner to the vast workers in the unorganized sector, and making sustained effort in this direction is, of course, a difficult task. Now, there are three categories of social security, that is social assistance program, food-based transfer programs, income transfer programs, and cash transfer programs which are there. We also have got social insurance schemes and welfare funds, which is there under the scheme of for the unorganized sector. Food-based transfer schemes, as we all know, are midday meals scheme of 1995, community grain bank scheme of 1996, targeted public distribution system of 1997, Antodaya Anna scheme of 2000, which is also under this particular scheme. Then we have got income transfer scheme, food for work program, Jawahar Rozgar Yojana, Sampurna Gram Swarozgar Yojana, Jawahar Gram Samriddhi Yojana, employment assurance schemes, Pradhan Mantri Gram Sadak Yojana, food for work program for calamity hit states, and Manrega, which is also under this particular scheme. We also have got the scheme that came into force from 2nd of February 2006, and the aim was to enhance livelihood. Funding of this particular schemes are done by the central government, that is the entire cost of wages of unskilled manual workers, and 75% of the cost of material, wages of skilled and semi-skilled workers. The state will bear 25% of the cost of material, wages of skilled and semi-skilled workers, and unemployment allowances. The coverage as in the year 2010-11, for which the figure exists, is 6,26,000 districts of India, and 120 million job cards were issued, where 55 million households provided employment to 49% share of women in the workforce. We also find that the cash transfer scheme that came up in India was initiated in 1995. The scheme is administered by Ministry of Rural Development. The government of India, through beneficiaries, could hail from other urban and rural areas. The NSAP is implemented in the state and union territories in accordance with the general conditions applicable to all components of NSAP. Now, that is Indira Gandhi National Old Age Pension, Indira Gandhi National Widow Pension Scheme, Indira Gandhi National Disability Pension Scheme, National Family Benefits Scheme, and Annapurna Scheme. There are certain new schemes which were added after 2014, or these schemes were renamed after that. Under the union budget of 12 and 13, raising the allocation under the National Social Assistance Program by 37% from 6,158 crores in 11-12 to 8,447 crores in 12-13. That is there. Then national assistance scheme are also there, where old age pension scheme is there. We find that national widow pension scheme is also there, and we have got national disability pension scheme which operates. We have got national family benefits scheme which operates, and Annapurna scheme which operates under this particular act. We also have Jan Shri Bima Yojana, Aam Aadmi Bima Yojana, Rashtriya Swasth Bima Yojana, and national health insurance schemes which are part of this particular scheme. We also find that there are schemes for BPL households from financial liability arising out of health shocks that involve hospitalization, and the benefit pays is up to 30,000 per year for most of the diseases that require hospitalization. Funding is 75% by the central government and 25% by the state government, which is there. And the coverage extends to 5 members of the BPL family, which includes the head of household, his spouse, and up to 3 dependents, children. Now, this scheme covers at the moment more than 20.8 million active smart card holders and 3.4 million total hospitalization cases which are there. We also have got labor welfare funds, healthcare, education, recreation, housing, and mica mines labor welfare funds of 1946, limestone and dolomite mines labor welfare funds of 1972, iron ore and manganese ore and chrome ore mines labor welfare funds of 1976, BD workers welfare funds of 1976, Cine Workers Welfare Fund of 1981, which are there. And we also have got Unorganized Workers Social Security Act of 2008 and National Skill Development Policy of 2008, which are there in force. What are the challenges that we have? Now, if you look at the challenges that is faced by India in terms of providing social security system, number one is the funding of social security measures. Right? This is a big issue. Where to get the funding? How to get the funding done? Then we also have got unavailability of reliable data, because data is not being provided by the individual employee, or is very, very difficult to gather because of the vastness and geographical locations that is there. Then there is a lack of involvement of people in designing the package of the diverse schemes which are being provided, a poorly designated and executed household targeting mechanism, and lack of coordination and overlap of delivery system that is also there. And then, of course, we also have got the issues of misappropriation of fund and nepotism, which is very, very common, that if 30 rupees gets initiated at the central level, by the time it reaches the beneficiary, they only get about 1 rupee. 29 rupees is, of course, being wasted as the cost of providing that particular scheme. Therefore, although these schemes are very, very noble, what we find that the benefit does not reach the employee because of various reasons which are there as far as the provision of social security scheme is concerned. Right? So this brings us to the end of this particular topic called social security benefits. If you have any question, please feel free. If I remember, I'll reply, else I'll reply you the next term, which is there. Yes. Anybody?
No, sir.
See, if you look at the syllabus, right, we have this provisions of Factories Act, where health and safety was there, voluntary welfare schemes for education, recreation, house, medical services. It was also there. Social security they need to join my class for the first two unit, which I will try and repeat. Okay. I have
Sure,
already,
sir.
just a minute, I have already sent you the questions for your assignment. 7 questions are there. You are supposed to write 5 of them. Uh, please do not try and copy, because soft copy you are going to send me, uh, or by scanning or whatever means, and it's very easy for me to compare and see where the copying has been done by all of you, because you are not right in front of my eyes, but you are not away from the eyes of the computer. Okay, so please do it by 28th. Time is written on that. I have already written the account that is to be submitted in Outlook, uh, my mail in the Outlook, which is there. Please do send it by that date, because late receiving will not be permitted.
So last date is 29th.
29th is
Yes,
it?
sir.
Yes, sir.
Yeah, so you
29th.
have mentioned 29th and the time is 2 p.m. By
Okay.
14 with us, we have to submit it.
If it is 29th, take it 29th. Don't take it 28th. Right? Fine.
Yes.
29th.
It can be typed.
Fine. 29th will do. I have no problems. Fine. If you
Sir,
have any question, please ask me.
sir, can it be typed or we have to write it?
See, I did write that it is your choice, your convenience, whatever you want to do it. As long as I received a legible handwriting which I can read with my deteriorating eyesight, I have no problems. Okay.
Okay.
So format can be anything, right? PDF or doc, right, sir? Or we have to submit it in doc only?
No, you can choose any. Doesn't matter.
Okay, sir.
Doesn't matter for me. You can choose any format. Length is written in almost all questions which you have done. If you check it, you will see that length is written.
Yes, sir. The word limit is there.
Written the length of your. So if you see that it says list 10 HR related reasons for not opting to joining a business organization in India upon completion of your MBA. So 10 points are to be emphasized. Second one says 10 arguments in favor. Is HR a profession? Then third is prepare the profile of millennial from Indian industry. Training without value system is worthless. 250 words. Developmental and fully transparent performance appraisal, 250 words. Industrial Disputes Act 1947 promotes workers' participation in management, 200 words only. List 10 reasons that has increased the importance of human resource management in India. So it's all written as to what you are supposed to do. Okay?
So,
All right.
so one more
Thank
thing, we can use an example to illustrate the question. Will it be fine if we use any example like from the past?
See, the thing is that your arguments are important. If you want to cite any example, that has to be there, then you can do that, but that will be brief.
Sure, sir. Sure.
All right?
Sure, sir.
Okay.
Thank you so much, sir.
Let me just check there is a telephone. Okay. Hello? I'm in a class. Can you call me in 5 minutes time, please? Okay. Yes, dear. Hello?
Yes, sir. Clear.
Okay. Fine. Thank you very much.
Thank you so much, sir.
So all of you are free from tomorrow from this particular class, except the health management students. Right?
Okay, sir. Okay, sir.
Health management students, I have a small request. If we can schedule your batch sometimes in the afternoon, that will be helpful for me because I can take 2 hours at a stretch and cover the things before Ramadan begins. In 4 or 5 sessions, I can complete the 2 units if I get 2 hours of time a day. Right? So any one of you can become a coordinator and you can interact with me about the time that you want. Any time after 2 o'clock will be fine for me. Ideal would be that you have it from, after 3 and before 6. Okay? Thank you. Thank you very much. Thank you, sir.
Thank
Thank
you,
you,
sir.
sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.